Hey, how's it going? My name's Kaiden and I'm from Melbourne, Australia, and I identify as non-binary transmasculine. This video is going to be about my consultation visit that I had with a surgeon for top surgery, and the surgeon that I decided to go with is Dr. Cheng, and he is over in Glen in Melbourne. So how I started the process was I went to my GP, who I see at Equinox Transgender Clinic in Abbotsford, and I went in to get my blood test results for my checkup as I'm on testosterone. And when I was in there getting the results, I asked how I go about getting a referral to see the surgeon, and she said that she could do that referral for me. So basically she wrote a letter stating that I was looking into top surgery and that I was on testosterone, and she sent that referral over to the surgeon and told me to wait a couple of weeks, and that the receptionist at the surgery place would give me a call to book a date, and if that they hadn't called me in a couple of weeks, then just to give them a call. So I waited 2.5 weeks, I think it took, and the reception lady gave me a call, and I was able to book in my consultation, which was about 4 weeks later, I think. And the consult I did was on the 21st of April. So 4 weeks wait time was pretty good, I think. And yeah, so I went in for my consultation with Dr. Chen, and he was really nice. I was obviously a little bit nervous to go into this consultation because I didn't know what to expect. But yeah, the moment that I walked in the door, all the staff were really kind, and yeah, just, it was good. Not what I thought it was gonna be like, but yeah, definitely not in a bad way. So I basically just filled out a form with my information, nothing out of the ordinary, kind of same as when you go to a new doctor, and you just fill out your name, address, allergies, Medicare card number, and all the general stuff that you normally fill out with. And yeah, so I went in and I met Dr. Cheng, and he was really nice, and very comforting. The consultation went for about 45 minutes long. I was able to take in my partner as well, which was really good, because I knew that I was not going to remember everything, so it was good to have another person in there for comfort, as well as, yeah, being able to absorb all the information that I was going to get, which was good. So basically he just asked me some questions about my medical history, if I knew of any, I don't know, like medical conditions that had gone through my family, whether it be like to do with my heart or blood pressure or you know, stuff to do with kidneys, all those questions. So I didn't have any troubles there. He asked if I was on testosterone, which I am, so I just told him what I was taking, and what else did he ask me? He basically took me into another room, and he got me to take off my top, which obviously is a little bit uncomfortable, but it's only for a minute or two, so it wasn't that bad. He had a look, and he had a little feel, just to make sure that I didn't have any lumps or anything like that. and he took a couple of photos, and yeah, it was over and done within like less than 5 minutes. So it was a little bit uncomfortable, but for the sake of, 3-4 minutes, it was okay. He asked if I wear a binder, and yeah, basically he was just taking down notes as he was asking me these questions, and he then showed me some photos from 2 different people that had 2 different scar placements, and these people were that he chose to show me the photos of were roughly around the size that I am. So he showed me one person that had a scar placement of just under the pecs, and kind of went along the like the muscle line, and then kind of curved up a little bit into the armpits. And then he showed me another one where the scar placement went kind of from the out of your body, went more up and met in the middle and came up higher into the chest, and was asking if I had a preference of scar placement. So I was leaning towards the one where the scars were more on the pec line, and he was happy for me to bring in some photos. He said that for the next consultation that I could bring in some photos of scar placement. He was very much not like, this is the way that I do it. You either have it like this or not, sort of thing. Like, he was very open to if I had something else in mind, that we could work together to, try and figure something out, which was really comforting, because it wasn't just like, oh, this is how I do it, sort of thing. Yeah, it was very open to the idea of me bringing in pictures of other people that I've seen of their scar placement that I liked, yeah, which I thought was really nice. And yeah, so he asked me if I wanted to do nipple grafts or not as well. And what else? He gave me a rough estimate in price. He said I was looking at around $10,000, and asked if I had private health insurance, which I do not. I've been planning to do this without private health. I've been saving up my money for the past couple of years now, and I just knew that the price range was going to be anywhere between $8,000 and about $12,000. So I pretty much had saved up my money to get to about $12,000 before I even booked my consult, because then I knew that if I'd saved to the higher end of the scale, then I knew that I would be all good. Yeah, but he said I was roughly looking at around $10,000. But in the next second consult, then we could go into more detail of exactly how much it was going to cost. So after that, he told me that I needed to get a psych assessment evaluation, which is called a WPATH letter or an OSPATH letter, which is a letter that you have to get from a psychiatrist, where they have to do a couple of sessions with you, just to check that you're going through this massive change in your body, and they want to make sure that you are making the right decision, and making a rash decision, and you've thought this through thoroughly, as it's a big change that you're going to be doing. It's a big surgery. So he said that before I booked my second consult with him, that he would like to know that I've at least got the ball rolling with getting this letter, and he gave me a list of people that he recommended that I could go see. It could be anywhere between 1 session, 5 sessions. I wasn't too sure exactly how many, as it differs from each person. And I got home and I pretty much went online and I googled all these places, and they were all saying that they didn't have any places for new patients. So at this point I knew there was going to be a long wait, but not even one person was taking any new patients on at all. So I got a little bit frustrated at that and got a bit flustered and going, what am I supposed to do? Which is where I just jumped online and I started trying to look for other places myself, and came across one guy who said that he wasn't taking any new patients, but he was happy to take on people if they just wanted this letter, because it was only going to be a handful of sessions rather than seeing somebody ongoing, which was really nice. So I sent an email through to him, and he gave me a call, and I was able to get in an appointment, which I've got next week. So the wait time for that was, I think, 3 or 4 weeks, which is not too bad. And so I basically booked that a couple of days after my consultation with Cheng. And after I'd booked in my first appointment for the psych assessment, then I called back the office where Dr. Cheng worked, which was a week after my initial consult, and I was able to book in my second consult, which I've got on the 21st of June, so only a month after my first one, which will be going into a bit more detail, and I think I'll be able to book in a date. So my initial consult cost me $210, and I got a Medicare rebate of $76, which only left me out of pocket of $134, which is not too bad. I'm not too sure on the cost on the psych consults. I'm assuming everywhere's different, but once I've had that and the second consult, then I'm going to do another video, and I'll be able to let you know how much that costs as well. So yeah, so far it's been pretty easy, one appointment, and got the other 2 already booked in. But yeah, he said that he was looking towards the end of the year, kind of December, January anyways. But yeah, second consult, I'll be able to hopefully lock in a date, and then we can take it from there. So yeah, thank you for watching my video. I hope this was of some help. If you have any questions, you can chuck them in the comments, and stay tuned for the video that I'll be doing for the next consult. If you like this video, give it a thumbs up, and if you're interested in seeing more videos for top surgery consultations and process, as well as I do videos for testosterone updates monthly. If you're into that, then you can subscribe, and yeah, I'll see you next time. Bye.